Welcome to The Dental Brief, the podcast that delivers actionable insights and expert strategies to help dental professionals like you grow, lead, and succeed. I'm your host, Patrick Shavasty, the president of Omni Premier Marketing. Every week at The Dental Brief, we bring you real conversations from expert speakers that offer expert advice and quick tips that make a real difference in practices nationwide. Whether you're a general dentist or run a multi-location practice, we've got you covered with content that's designed to help you attract more patients, to streamline your operations, reduce headaches in managing your practice, and increase your profitability. If you're ready to elevate your practice, be sure to subscribe, hit the notifications bell, and let's dive into today's episode of The Dental Brief. Hello, everyone. Welcome to another episode of The Dental Brief. This is our first recording in the new year, so we're excited to get things kicked off in a great way. We've got an awesome doctor that's going to share with us today. Dr. Conor Casey, say hello to everyone.
How's it going, everybody?
Thanks
for having me.
Yeah, we're always grateful when doctors take their time to share with us. You're actually a prosthodontist. I want to jump right where we always do. Tell me, how did you get involved in dentistry? What made you decide to become a prosthodontist?
Growing up, I had a great dentist that I absolutely loved. I'm one of those few people that have been blessed to never have a cavity. So dentistry to me was just about being a dental patient, I should say, was always a great experience. I'm fortunate enough this day that my dentist, when I was growing up, is now my patient. And dentistry, I think as I got older, kind of became a means to having control over my life. And I didn't have any wild experiences that kind of made me feel like I had that. But what it did is check a number of boxes for me. So when I went to college, it was probably my third year. I was going to school in the Twin Cities. I said, I probably should figure out what dentists are doing in their offices besides just cleaning people's teeth, from what I thought. Sure. Right. Then I went and I started seeing, I was like, oh my gosh, this is way different than what I experienced. But I was like, I'm too far into this to change now. But going to dental school was a great experience, but again, as we all know, very difficult. But when I left school, I knew that there was more out there, more complex procedures. We're all bathed in fire, truthfully, when we get out of dental school. And so I actually worked 2 years before I went back and did pros. And for me, pros is more about going back, taking this experience that I had in private practice and really trying to hone the experience and hone my knowledge. With that short period of time that I was in private practice, I went to some CE courses. I talked to pros faculty, and it just seemed like something that I wanted to do. They were teaching dental implants at some of the residencies that I was looking at. Dental implants was something I really wanted to incorporate into my practice, and I really valued kind of having a formal education at the time to get that experience.
Yep. So I know we're going to talk a little bit about restorative-driven implants here in a minute. Through your experience with working with general dentists, through working with patients, through really getting involved in implants, through those experiences and your travels, what are some big challenges that you see that dentists are having right now? What do you see that they're facing, struggling with, that could be much better for them?
Being a mentor, that does give me that opportunity to speak to dentists in an educational setting. One of the things I feel right now is that there has never been a better time to be a dentist. But I think the second half of that is there's probably never been a harder time in history to really run a dental practice. Technology is phenomenal these days. It's helping us. Patients are so much more informed. Social media, even us dentists, we see other dentists on these forums that are posting things. I say we see a lot of miracle dentistry. We see the beginning and we see the end, but we never see the process along. Sure. So I think that there just is this pressure from patients and pressure that we put on ourselves to achieve. At dentists, we've always achieved in school. We've always have high aspirations. And I think that when we leave school, we're not always trained to be the type of dentist that we want to. There's so much more that we can do that we want to do, but there's not, we're kind of left up to our own to try to figure these out. Now, in some respects, we're not on our own. We do have avenues, but how do we get there? How do we incorporate new procedures? How, with insurance reimbursements decreasing, costs going up, like these are bigger things to add to the practice because not only is there this desire, but there's also can be this fear of failure. And fear of failure also comes with, I spent a lot of money, I invested a lot of my time, I did not get a good return on that investment. Like those are all things that kind of hold us back. So I think adding these things and how do I do it well is this overall theme that I hear, at least people in my courses that I help teach and express.
Yeah. So let's talk about the courses that you teach. And I know these courses you're teaching are with restorative driven implants, correct?
Yes.
So tell me, what are the benefits of training through RDI? By the way, the website for those of you that want to check it out is restorative-drivenimplants.com. Right on the homepage, you're going to see learn more. There's a great guide on there you can download. You can register for some events that are coming up. Tell me a little bit different about the courses and the teachings at RDI than you'll find at other implant type courses.
Yeah. I had the luxury of being trained in like a formal setting. So a periodontist would come into our clinic, our pros clinic, and they would give us fantastic kind of one-on-one or all student faculty ratios. And also being a part of education, I also got the luxury of going to a lot of courses and even not necessarily treating, but kind of helping in implant courses that our program tried to put on. And when I joined RDI, I actually joined RDI first as a student. And I was placing implants already, but the reason I was a student is trying to figure out, well, what is this group about? What are they teaching? And one of the things like that I found is that the organization of this course was bar none the best I had ever been a part of, whether as a student taking it or whether I was teaching it. The patient selection in terms of like the surgical days, some of the things like I ran into when I was helping with courses was that patients weren't vetted. Oftentimes, first-time placers were getting into very complex procedures that really probably made them shy away from placing implants because they were just so difficult and mentors having to step in way too often. So it is the organization, it is the research behind the whole curriculum. We work with a phenomenal implant system that gives so many options as far as for advanced placements and just routine placements. So the other thing I think that's important for new placers or people learning about, and honestly, even experienced placers, if you're not placing 100 implants a year, you kind of are a novice in some respects. Like there are probably things you haven't quite seen. And so what I really like too about this course is there's a checklist, so to say. These are the things that I want to see so that I am staying in this area of success. Sometimes we call it like the green zone, that like, if I meet these factors, I can feel very confident that I'm going to get through this process and I'm going to be successful. And then I know where's the yellow, where am I being cautioned, and where's the red, where it's like, do not go into this area. Because most people, when they take courses, they don't come back and have somebody there to continue to help them. Like sometimes It's hard to find that mentor after mentorship at RDI. And we really try to set people up that they are very prepared and that they're able to deal with any kind of changes to the plan.
Yeah, that makes sense to me. And there is on the success formula that you list out on the website. It's great. I recommend people take a look at that. From my point of view as a marketer, one thing that I see often with dentists is they want to get into implants because they're trying to figure out a way to make their practice is more profitable.
Yeah.
But then once they start doing some of them, and they're not really doing a significant amount, two things happen. One, they take a lot more time than they thought. Right? Mm-hmm. So then it's not quite as productive as they thought as far as chair time. And then the other thing is they stress. So it actually brings more stress, right? Because I've actually had dentists say, like, I can't sleep at night because I'm wondering if that implant place is going to fail or not. I can't imagine what that feels like. Like, I would not want to be in that position. It seems like what you're talking about here, and I think for our listeners to know, is there's certainly a way to avoid this, right? There's a way through mentorship, through your program, to make sure that you have confidence in what you're doing and that there's somebody there, if you can't sleep at night, that you can call, obviously not in the middle of the night, but that you can call and walk you through the details here. Is that pretty accurate?
Yeah, I think mentorship, whether it's at the program or afterwards, is so important. And like personally, like so many of our students come through and I've made personal connections, and occasionally I've, checked in on them, see how it's going. I still get texts from students that, hey, can you look at this? What do you think? And I love doing that. And I'm very close to the other mentors at RDI. Like when I became a mentor, I hit it off with them very quickly, and they were just like best friends, and they're all just great people, and they're there for others too, and they're there for their students and maintain the same things. And we want people to place, and that uncertainty that you mentioned, one of the things like we really try to stress too is we want you to place implants, and we want you to do it as soon as you leave session 3 after the surgical day. So we're constantly asking, who's your first 5 patients? Like let's find these patients when we start. The RDI is 3 sessions over a 3-month period. Like that is time to get those extractions and grafts, allow them to heal, find your healed ridge. Like let's get you through that. And dentists that do that make a plan, that they write that plan out, that they have goals and milestones that they're going to meet by a certain period of time. Those are the ones that come into it fresh, that they're not stressed. They're not freaking out their dental staff. Like, oh gosh, something's wrong with Dr. So-and-so. Watch out. I guess it's that implant, because that's going to make your staff not want you to place either. And you need to have your staff behind you to make these as stress-free as possible.
Right. The buy-in's critical.
Absolutely.
So somebody wants to check out RDI or check out the sponsors, go to restorative-dental-implants.com. Again, there's plenty of information on there. You have a couple of events coming up. Spring and fall 2026 is open. February 27th looks like it's the first courses. Is there room still to get in there? Or is that one booked up?
They usually book up pretty fast. I don't know 100%, but yeah, usually by the time you decide you want to do it, if you're not on it, it's full.
Yeah. Check it out, folks. Get on the list. Reach out to Dr. Casey or any of the other mentors at RDI. Dr. Casey, thank you so much for coming on today and sharing. We really appreciate it.
Thanks, Patrick. Really nice to see you.
Thanks for listening to this episode of The Dental Brief. If you found it helpful, give it a thumbs up, subscribe to the channel, and share it with a colleague who could benefit. We're here to help dental professionals like you stay ahead of the curve, one brief episode at a time. You can find more episodes and resources at thedentalbrief.com. You can also join the Growth-Minded Dentist community on Facebook. Links are in the description. Until next time, keep learning, keep growing, and thanks for being part of the Dental Brief community.